fellow at African School of Economics. I will be presenting a paper on health insurance and labor supply. I will try to look at the relationship between health insurance and labor supply. But where is this study started from? Actually, I went to the field for one of the most interested and very beautiful project of IREM. It was about team incentive for bureaucrats. We were on the field, and the focus was on local workers, and we were allowed to conduct a focus group with them. And one of the main questions of the focus group was on the fact that after those local workers, they perform very well at what they are doing, what is the best way for them to get rewarded? And I was really surprised by the answer most of them they give. Actually, I was expecting to have an answer related to money, to cash. But most of them, they say that the best way for them to be rewarded is by having health insurance. So I was not able to discuss a bit about the problem because it was not the focus for that discussion with them. So when I went home, I tried to dig a bit about the problem. I went to our National Direction of Insurance in Benin here, and I asked the guy I met that day, what is the policy of health insurance for civil servants in our country? The guy was surprised because I asked such a question, and he said there is no policy for civil servants regarding health insurance. Health insurance is only available when the worker is in private sector, and even if the public administration wants its workers to get health insurance, they are allowed to do it directly. So there is no public policy about health insurance. So I went to the literature and I saw a couple of work that deal with the same topic. First of all, let me highlight the fact that according to the World Bank, the reports from the World Bank in 2015 and 2015, sorry, there is a big challenge for labor supply in developing countries, especially in sub-Saharan Africa. The problem is like we have the most and the important labor force coming for the next generation. Actually, they say that for the next generation, the 10 youngest countries of Africa will be founded in the continent, in Africa. And the second report coming from Sender in 2005 is saying that to be able to challenge that labor force, it's important to take care of education and also the way we can improve the workers' health. The same report from the World Bank said that the labor force coming can contribute to the increase of the production by 11 to 15% of the entire continent. So there is something that it's important and we need to do, we need to challenge regarding health insurance to be able to get the best coming from the workers. And also, I saw the paper of those three guys in 2014 that highlight the fact that in low-income context, employees try to secure health insurance available at the working place. Actually, they try to analyze the effect of the disenrollment of Tennessee Care. Tennessee Care was a program that was implemented in one of the states of the United States. And when it came to stop the program, the finding was that the labor force started increasing. Why? Because people who were finding benefit from the Teen Scare program were able to not work. They were able to just stay at home because health insurance is a universal coverage. So when the program stopped, people started finding jobs. They started going to look at jobs because they are able now to secure health insurance and to work more. The second paper coming from the literature I want to show is the one coming from Bailey and French in 2011. The paper used a dynamic programming model of retirement, and they found that even if they increase the eligibility of people to the program named Medicare from 65 years to 67, there is a little bit impact on the behavior on the labor market. Actually, the finding also here try to show that people care a lot about the medical expense, and because medical expense tend to be very important, and they want to avoid those decisions about medical expense, and they also want to stay a bit in the working environment to benefit from the health insurance provided by employer. The last paper is a paper conducted in Tanzania, and this paper used an empirical strategy to look at how increasing the quality of health, here health insurance, can affect labor supply. Actually, the paper tried to see how health insurance can increase the quality of health of people. And they found that when health insurance are available, it decreased the probability of people to get ill by 60%. And because people have much more time, they are able to allocate that time to work and to work more. And they are also available on the labor market. So to try to look at the relationship between health insurance and labor supply, first of all, we describe a theoretical framework that can help to grab the relationship between those two aggregates. So the framework here is describing by using an agent in an environment. We suppose that each agent in the environment are characterized by the age, by the education level, by the fact that health insurance are available at the workplace, and also if the guy or the individual have access, are covered by health insurance. Though at each period, at each time of the lifetime, they try to maximize this utility function. They maximize the utility function according to the consumption, the labor supply, and also the health insurance for the next period. And we can see that the budget constraint is, we try to set the budget constraint. Here we have the resource of each agent. They have at the beginning of each period the asset. This is the wage, which is function of the hour worked, the education level, and also the labor shock. And they have to pay taxes from the wage. And one of the main assumptions here is that we suppose that they are paying taxes, but they are not paying taxes on the health insurance they are buying for the next period. And they can also receive a transfer from the government, which is captured by this variable. Those resources are shared between what they can, are sharing between the assets from the next period, the consumption, the parts of medical expense they have to use, and also the part of money they use to buy health insurance for labor supply. So we use the log from for the labor productivity shock, and it's equal to Bj plus Y plus V. And we suppose that Bj is the determinist age-specific component, B is the transitory shock, and Y is the persistent shock that we approximate with an AR1 process. Phi is a persistent coefficient. So the first description was about a working agent. Now, when agents get retired, we take out everything that is related to labor, and they only care about consumption. So they will maximize this function. The constraint here, the budget constraint here is only the asset for the current period, the social security they get, and also a transfer they can get from the government. And here they will share those resources between the asset for the next period, the consumption, and also the part of medical expense they have to use. So we also try to capture what the government can first transfer to each individual in the economy. And the first transfer related to working agent is this one. So the government will transfer the max between this thing and 0. So they will look at the consumption floor of each individual, the medical expense of the individual, the wage they get after they pay the taxes, and the asset, and either individual will save this one or 0 if this one is for sure if it's negative. And for the second transfer, it's related to the retired, and we just need to take out what is related to labor supply. So the government is always they are spending money between those 1, 2, and 3 programs we designed here. The first one is the transfer. It's concern only the working agent. The second one concerns the retired, and also this is the remaining tax that is thrown away in each period, and this should be equal to the taxes they collected from household. So we suppose here that 2 main sectors are characterized in our economy. We have the consumption of goods and also the healthcare, and both have the same and the unique production function, the Cobb-Douglas one, which is Y is equal to A K alpha L1 minus alpha. So the maximization problem gives the result here. So according to the health insurance company, we assume that they are all behaving in a competitive system, and they provide equivalent premium employed to each agent, and this is the part of the amount paid by the employee, and the remaining part is paid by the agent. So after we try to simulate what will be the result if we implemented in 3 different experiments. The first one was the baseline, the second was the experiment 1, which is where health insurance is available for everyone, it's a universal coverage, and the last one was only when health insurance is provided by the employer. So we can see that most of the aggregate present here, most of them has a high value when we reach the employer provided health insurance. Why? Because when the health insurance is available universally, when there is a universal coverage, people tend to work less. They become being lazy, and because the health insurance is available somehow, they don't try to remain in the work sector, or they don't try to remain in the labor supply labor market, thank you, and they just try to benefit from the universal coverage. But here, when it comes to work, when it comes to insure health insurance, to have health insurance at the workplace, people are willing to work more. They accept to spend much more time on work because they don't want to face medical expense, and also they want to use the main part of the income for consumption and something else. So now we try to look at the empirical part of this topic, and we were interested in looking at what is going on in Ghana. Why do we try to look at Ghana? Because in 2003, the government of Ghana tried to put in place a new policy that made available health insurance for every citizen in the country. And the policy was mainly set in place to avoid out-of-pocket and also to help people to face medical expense in such a way that they are not throwing out all of the income. So we use the database from the Ghana Living Survey, the round 6, and the data was collected from 2012 to 2013, and it was collected by the Ghanaian Living Ghanaian Statistical Service, and the database was about information on education, demographic characteristics, health, employment and time use, housing condition, and also agriculture. We are interested in looking at the treatment variable, which is health insurance, and one question in our database asks the respondents if they get any coverage between during the last year. The outcome variable, the hour worked, capture how many hours the respondent used to work the week before the interview. And we use some of the control variables: age, education, sex, income, marital status. So this is the summary statistics of our variable we used. And we are interested in estimating the following equation: yi is equal to alpha plus beta, the treatment variable here, if individual has any of the health insurance scheme or not, the covariate, and the error term. So in the absence of randomization, we use a new and relevant matching technique called the coercion exact matching. Why do we use that method? Here, the coercion exact matching method allow the users to set, first of all, the bins of the variable, the covariate we want to match our data with, and the technique works in such a way that for each covariate, the method look at the information between that variable and create a strata, put in that strata at least one control and one treatment variable, and in such a way that they have the same information. So we can have many strata, and if we don't have at least one control and one treatment variable in that strata, we just delete that strata, and after we can compute the average treatment effect. So the CM try to compute the imbalance measure, and the imbalance measure compute the multidimensional histogram of covariates regarding the treatment variable and the control variable. So after that, we use those assumptions we have talked about earlier. I will try to go fast. So this is the result coming from our imbalance measure. We can see that for our variable, the statistic we compute is very low, and when it's very close to 0, it means that we have a good balance between the treatment and the control group. So we can say that the balance here is somehow well realized. So after that, we compute the average treatment effect and the average treatment effect on the treaty, and we can notice that the effect of health insurance on labor supply is somehow positive and also significant. So for the policy application, as we expect, we see that health insurance increases the hour worked because people who are working, they see health insurance as something that can help them to reduce medical expense, and that also can help them to stay or to increase their ability to work. And we noticed that according to Curry and Madrion in 1999, they found that health affects labor market outcome, but we should be we should look closely at that relationship, because as we saw in the theoretical framework, we noticed that when the health insurance is available at the available for the entire population, this can also have not a really good effect on the labor supply. So we can think about set in place a policy that can help, or that can bring people to have health insurance at the working place, and this will also benefit from for the labor supply. So we try to look at some limits of the work, and as you noticed, we use a self-reported variable named the hour work, and this variable can be overestimated or underestimated by the respondent. So we are trying to have a kind of variable that can measure directly, like maybe when workers come to work, there is a book where they write down the hour they are there and the hour they are leaving. So having that kind of variable will be very interesting and very precise for our work. The second limit we found is that employment can decrease health status when maybe you work at a firm production and you have to work on heavy matching. This can be also something bad for your health status and also decrease your labor supply. So because it's still a working paper, we are trying to look at an instrument variable that can solve most of the problem in this work. So thank you for your attention.